Okay, this is an easy one.
Frontalis.
Okay, this is
Frontal belly.
frontal belly of occipitalis, frontalis, occipitalis, and this is occipitalis. So this is the anchor, and in between we have a flat tendon, which is called an aponeurosis. Legalia, aponeurotica, goes by many names, okay? So this is like a base, and that allows you to contract this muscle, which raises your eyebrows, and gives you those wrinkles across your forehead. Is that like you're getting right now? Just watch it. Now you can laugh about it. Later on you won't. Now, encircling the eye is what type of muscle?
Orbicular.
No, what type of muscle?
Sphincter.
Sphincter.
Sphincter,
Okay.
that's right.
And this is the orbicularis oculi. So that's pretty easy. Because you close your eye or wink. And around your mouth, another sphincter. Orbicularis oris, okay. So they close your mouth, protrude your lips, the kissing muscle. Okay. The frontalis is sometimes called the surprise muscle. On the side, this is the temporalis, right?
Yep.
That's involved in chewing, okay? As is the masseter, okay? And you put your fingers here and clench your teeth,
That's the
do it, right?
Yeah.
And turn tooth. And when people are uptight, they do that, so watch out. You see that going in and out on somebody, they're about ready to pop you, maybe. The temporalis is also involved in headaches, okay? Some of these others are involved in headaches too. Okay. Going from the zygomatic bone into the corners of the mouth.
Zygomatic
Major, okay. This is the minor here. Okay. Yeah, there's a minor also. I think that probably gives you that look of the, like Elvis Presley maybe?
Yeah.
I think that's the levator labi, no?
Well, no, that's a different one. That's when it comes out straight down one. Okay. This is also, that's probably Resorius there. You can't see the mass, okay, you can see the masseter for chewing. Underneath it, not shown here, I don't think, right here. Maybe that's it, I'm not sure. Okay. The buccinator. Buccinator is both an expression muscle and also a chewing muscle. Okay. So it holds your cheeks in. It also, it's a trumpeter's muscle. You can see, if you ever seen a serious trumpeter, they get so huge, it looks like they're going to pop. Okay. But it holds food between your teeth, too. Now, zygomatic major is a smiling muscle. For frowning, we use the depressor anguli oris. So both inserting into the corners of the mouth. This makes you frown. Deep here, but you can't see it, is the corrugators superciliary. No, I'm leaving out something.
It's the corrugator super.
That's the blinker.
I think I'm leaving out something. But it's the one that pulls your eyebrows together and gives you those frown lines in the middle. And I mention it just mainly because that's where a lot of people get Botox injections. You know, movie stars and stuff like that, so they won't have those frown. Corrugators, superciliary. I'm looking up something, I think. Corrugator.
Corrugated superciliary.
I think it's,
I think
a
more than that.
corrugator superciliary.
I don't think it's, not the.
Her name's here. I want to make sure I get you the right name here. I didn't used to require this one, and I do now.
I think that would have been, it would have
Let
been.
me back there. Let me see, I think I can find it faster. No, just, I guess I was right. Corrugator superciliary is always called. Seems like there should be another word in there. Okay. Now, not shown here, and we have a head in the other room, by the way. If you haven't seen it, we have a dissected head. And there's a muscle covering this area here, but it's missing right here, okay? Because this is the platysma. And that's for horror and fright,
Frightened.
okay? Or for shaking. It tenses the skin here. Starts down here in the fascia here, and it starts along the sort of jawline on there. Okay. But deep to that is a very important muscle called the sternocleidomastoid muscle. If you contract one side, your chin goes up like that. That's called a wry neck. Some people are born that way with a birth injury. If you do both sides, though, your head goes down because insertions move towards origins. Okay? So that's sometimes called the prayer muscle. The smiling muscle, whatever, frowning muscle. And there's a bunch of small muscles in here. So a lot of them insert into the hyoid bone, which I can see here. suprahyoid, infrahyoid group. In my class, I don't really stress them. If you're at San Ramon, I guess you are stressing them,
Yes,
right?
the
so-
Ohio.
Yeah,
Sternohyoid.
yeah, I know. I'm not doing that much, so I don't even know a lot of those myself. Okay, let's look in the back here. Here. Now, this is an important muscle and very obvious. The trapezius. So on one side, it looks like a triangle. When you put them two together, you have a trapezoid. Trapezoid. So that's why it's called the trapezius, okay?
That makes sense. That's
Okay,
what
and it starts on the external occipital protuberance, right down there, and there's something called ligamentum nuchae, goes down to C7, T1 through T12. So big, broad origin. And the muscle can be divided into different parts, so different parts do different things. Basically inserts into the spine of the scapula, the acromion, and watch out, it also comes around to the clavicle. So it's obvious on some of those bodybuilders. You can see, you know, other people, ordinary people like us, maybe not so much. But it actually is very obvious in some of the bodybuilders. It has a lot to do with moving the scapula. Okay? So raise your shoulders, shrug your shoulders, you know, backward rotation also. Standing up straight, blah, blah, blah. Now, deep to this muscle is the rhomboids. And frankly, most of the time I have trouble separating the two apart. Okay? So if I were to stick a pin, for people that are in this class, they're in the lower part, assume that's the rhomboid major. If I stick it up high, assume it's a rhomboid minor.
I think
But
we can assume that too, because he's.
it's really hard to separate them sometimes, okay? So they also can pull things together here, so. But that's the rhomboid major. The major is the bigger one, and minor is the top one. Okay, now we also have a lot of muscles that are on the scapula. And so below the spine would be the infraspinatus. Above the spine would be the supraspinatus. On the other side, which you can't see because it's hidden,
Subscapularis.
subscapularis. And the teres minor. Watch out. Also, these can be difficult to separate. And sometimes the teres minor kind of joins with the infraspinatus. Okay? But it's much smaller. Now, this teres major is not part of the rotator cuff. Those other four are what called the rotator cuff muscles. And they're important because they help stabilize that shoulder joint. It's not very stable. But what stability they get is largely from the rotator cuff muscles, which do various things. I'm not holding my class responsible for them. Maybe you are.
No, I don't think
Yeah,
so.
I don't
think
think
we should
so,
know
just
the
know
muscles
what they
and figure
are,
out.
yeah.
Yeah.
But the three, the supraspinatus, infraspinatus, subscapularis, and teres minor insert into the capsule surrounding that joint. The three in back go into the greater tubercle. Okay, greater tubercle. The subscapularis comes through into the lesser tubercle. Okay. But what's not reinforced is when you dislocate, you tend to dislocate forward and downward because that's not reinforced. Now, the teres minor is part of it, but teres major is not because it inserts too low to be much use. Now, there's another muscle that's very important for stabilizing the shoulder joint. What is that?
Deltoid.
Nope.
Oh, that's for the humor.
Is that the subclavicular? No.
Pectoralis minor?
I haven't heard.
Pectoralis minor?
I already said teres minor.
Oh, no, pectoralis?
No. Huh? What helps stabilize the shoulder joint here? And it's a muscle you know very well. No.
You know, very
Pectoralis major?
No, no, no. No, 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 no. No, 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 no.
It's not the subclavicular, okay.
Tropian?
Biceps brachii. Because look at this muscle here. It has two heads. One head goes up through the intertubercular groove, also known as bicipital groove or sulcus, and inserts at the supraglenoid tubercle. So it helps stabilize that joint too. The shorter head goes to the coracoid process. So that helps stabilize the joint. So the four rotator cuff muscles, the biceps brachii, their tendons are more important usually than ligaments for stabilizing joint. Those tendons help stabilize that shoulder joint. But is it a very stable joint?
No.
No, it's crap, okay?
That's 'cause it's the most
It's the most mobile joint, but very frequently dislocated, okay? Okay, let's see, okay. Now, let's talk about muscles that move the arm at the shoulder joint, okay? So, what does the trapezius do?
Stabilize.
elevator?
press through?
To the arm. What does it do to the arm?
Nothing,
Doesn't it?
nothing at all.
Nothing.
Nothing.
Nothing at all.
This guy.
Because it does not insert onto the arm. It inserts onto the scapula, not the arm. But it's very close there, so people sometimes get the idea that it's doing something on. Nothing at all. Now, one very important thing to remember, I think, is above the knees, muscles are in front of a joint, anterior to a joint, tend to be flexors. Muscles that are posterior to the joint tend to be extensors. Extensors. And at the knee, it gets all screwed up because the knee bends backwards, not forward. You know? So, but above that, most everything in front of a joint is going to be a flexor. Most everything behind the joint is going to be extensor. Now, there's a few things that screw it up because we have some supinators and pronators in there too. But, okay, let's see. So let's look at some things that do work on the arm. Okay, this is a favorite muscle of mine. So you shouldn't get confused with that one, right? Latissimus, meaning it's the widest. Dorsi refers to the back. I mean, how can you screw that up? Okay, latissimus dorsi.
Challenge yourself.
Oh, don't say that. Maybe you would. But it comes around underneath the arm to insert on the intertubercular groove. Okay? So we have several things going through the intertubercular groove. This is one of them. Okay? So it's underneath your arm. So this part that you feel here, a lot of that is the latissimus dorsi. I mean, back here, in the back, I mean, up front. Back part.
They said the swimmers.
Yeah, this is called the swimmer's muscle because it does things like behind the joint, so it's going to cause extension. This is extension. When I used to swim, my coach was always telling me to rotate more because I was swimming too flat in the water. You swim
Boxer's
flat,
muscles, serratus
you're
muscles.
extending using your triceps. But if you bend, like, rotate, now you're using your latissimus dorsi, which is bigger, latissimus dorsi or your triceps. So that's a bit more powerful muscle. It also causes adduction. So it causes adduction and also extension. This is behind the joint. This is also a useful muscle for breast reconstruction sometimes. So if someone has mastectomy, sometimes they bring that around, keep the blood supply and the nerve supply, and you can use it for that too. Also, sometimes it's used to wrap around the heart to help out a sick heart. But of course, you have to keep sending it messages because it doesn't contract on its own like the heart would. So as a former swimmer, I wouldn't want them to take away my latissimus dorsi. I'd rather have implants if I had to, you know? Okay, so that's an important one, right? In the front, we have the what?
Pectoralis major.
Pectoralis major. It also inserts, well, I think one of them they said some other thing, but I just tell my students to think intertubercular groove. It also, I guess it's probably also considered to be maybe the lesser tubercle, I'm not sure. But I just say intertubercular groove for both of them. But this coming from the opposite side, so this causes flexion, right?
Yeah.
Anterior flexion. A broad origin, as you can see here. Okay. Flexion, okay? It also causes adduction. So if you put your hand here and then try to move it in, you'll feel that muscle, right?
Oh, yeah.
Okay? Yeah. But this is flexion of the shoulder. This is extension of the shoulder. Hyperextension. So that's something that's not so obvious in some ways, right? Just remember, if you were in an anatomical position, not counting your feet, but the rest of you, basically you're extended. If you're in fetal position, basically most of you is flexed. What's the third muscle involved here at the shoulder?
Deltoid?
Deltoid. Okay, and it has a broad origin too in a way. It's a multipennate muscle. It originates on the clavicle, acromion, and spine of the scapula. So it actually has three parts to it. So it helps out with flexion, it helps out with extension, but its major thing is abduction, adduction. Deltoid. And it inserts onto the deltoid tuberosity, surprise, surprise. Right? Okay. Okay, where else are we now? Now, underneath the pectoralis major, by the way, are the pec minors. This gives you poor posture. It pulls you forward. Okay. Also, poor posture would be the serratus anterior. See this little zigzaggy in here? Serratus anterior. There's also serratus posterior ones too. I don't know if you have to know those, but
Yes. Yep.
okay. But anyway, they're pretty obvious because they're serrated, like a knife, a bread knife, right? And if you dissect them well, they're pretty obvious. And they interdigitate with the external obliques. Okay, external obliques. Well, we're talking about external obliques. They're actually part of a big muscle group that comes down. Underneath the pec major, you can't see it, are the external intercostals. So external intercostals and external obliques really are part of one big muscle. It's just the external intercostals are separated by ribs. And they go diagonally downward. So they're sometimes called the pocket muscles because you can, the same orientation if you put your hands in your pockets. Okay. Also, deep to that would be the internal obliques. Again, a big muscle group, okay? Separated by muscles, okay? And then deeper even than that, because we don't have three sides here, would be the transversus abdominis. Now, all three of these are just along the side, just along the side. And think of it as like plywood, having different layers going different directions, that makes it stronger. And I mean, they all insert by way of this rectus sheath into the linea alba, which means white line, okay? And the rectus sheath is a type of aponeurosis. Now, within the aponeurosis rectus sheath is this muscle,
The rectus abdominis.
rectus abdominis. So that tells you where it is. Straight up and down. Rectus means straight, but it's separated by
The
tendinous intersections, right? Okay. And its origin be down here, so the insertion moves towards the origin when you do sit-ups. But the ones they show in the movie are incorrect. Those sit-ups, you shouldn't be doing them that way. It makes your psoas major too strong. I think that's part of the problem. But this is called six-pack with your knees bent, and your arms like this. But this is called a six-pack, but it's really an eight-pack. Okay. The transversus abdominis, I just read the other day, is sometimes called the corset muscle. These all together kind of hold you in, right, like a natural girdle. If they get weak, then you get the pot belly. Okay. But let's see what else I want to say here. Okay, so but this is totally enclosed here. Okay. Let's see. Not seen here underneath is a dome-shaped muscle called the diaphragm. It's skeletal muscle, but it's under partially voluntary control, partially involuntary control. Okay, so it's kind of unique that way. And at Taco Bell, it's called skirt steak. Okay. So if you order the skirt steak, you know which tells then you're eating somebody's diaphragm. Now, I have to admit, I have gone to an autopsy and later gone out and had ribs. It reminded me, I haven't had ribs for a while. Okay. Let's see, what else do we have in here?
Can I ask?
Yeah.
Are these the serratus posterior in the back here?
Yeah, that should, I think that
Serratus
is raised.
posterior.
Yeah, back there. Yeah.
Okay.
Oh, and these are the anterior right here?
Yeah. Serratus
Okay.
anterior is
And
called.
those, and so then this would be the internal,
External obliques.
obliques.
Yeah, and then internal obliques are deeper, and then transversus abdominis is totally deep, okay? Okay, let's see what else I want to cover here. Okay, now this, by the way, is the thoracolumbar fascia, part of the origin for that, this is dorsi, okay? So that's the widest muscle in the back, okay? Okay, what's this big muscle? Gluteus maximus. And let me just mention that there's places where people get intramuscular injections. We talked about subcutaneous injections maybe in class before, but sometimes people need intramuscular injections, and you don't want to stick it in the wrong place, okay? One of the wrong places, which is real risky, is the gluteus maximus, because there's a big nerve right under there. What nerve is that? Sciatic nerve. Okay, so those of you that are dissecting now, watch out for the sciatic nerve, because it's actually two nerves bundled together, and it splits naturally above the knee. Don't go separating them more, because if it's bundled, then they separate, okay? But you have to be careful, because the sciatic nerve is running right down in there. Okay. So a safer place, if you were to divide this up into quadrants, is the upper right corner, or upper left corner. And so the gluteus medius is a better place, maybe, to inject it. And there's also a minimus underneath, too. Okay, so gluteus maximus, is that important in walking?
Yes.
No. No. It's important for jumping and climbing. So it's not important usually in walking. Gluteus medius is, but not the minimus, okay? I mean, in maximus, not the maximus.
Stairmaster.
Yeah, so you work on Stairmaster, you're working on your gluteus maximus, okay?
Is it because
That's a
like
nice
your
little firm
knees
butt,
are
huh?
going higher? Because you're bringing your knees up
Well,
higher?
it's for extension more, okay. Also sort of hidden in here, now this is the iliotibial tract right here, right? It's a tendon. I tell everybody not to cut it, but we always get somebody cutting it each semester. In fact, one semester, one of my TAs cut it away. So this is called, it's buried within that, but so we've dissected it out on our cadavers. This is called a what?
That's just about right.
No. Tensor fascia latae, okay? People always think it was coffee muscle or something.
The coffee.
Yeah, coffee muscle. So that's buried within the fascia, but you can dissect it out, okay? Abduction, stuff like that.
And that's amazing.
This is lateral, going lateral, going lateral. Okay, let's look at some muscles here, okay? Let me get that out of the way.
You can remove it.
You can't do that with people, so don't try. Okay? Okay, let's look at the longest muscle in the body. Sartorius, because it allows you to sit cross. I'm just going to do half of it so I don't fall off my chair, right? Like this. So that, and it starts where? It originates on the Chris, at the anterior superior iliac spine, okay? That's the sartorius. That's where it originates, and then I guess the superior lip of the acetabular. Okay. But and it goes across the thigh, so it's very obvious. It's not really a very important muscle compared to other muscles, but it's very obvious, and you can certainly see it on the bodybuilders back then. And it actually crosses two joints, so it crosses things at at two joints, and it inserts way down here on the tibia, not on the tibial tuberosity though. A little bit medial to that. I haven't covered this in my class yet, but the pes anserinus is called. 3 muscles insert there together. Pes anserinus. It means goose's foot. So you might not have it, but I can write my class, and my class better know it. The nice thing is 3 muscles insert there. So remember that. And one of my volunteers, John, those of you know John, he taught me that, and because he was working, I guess, with a lot of, I think, orthopedic surgeons, and they call it, they were like guys soccer sucks. No, girls soccer sucks. But I thought guys soccer sucks were just as good. And so the gracilis, the semi-tendinosus, and sartorius, so GSS, they all insert in the same place, a little bit medial to the tibial tuberosity. Okay, now let's do some of these muscles here. Up high is the pectineus. Maybe that's it there. It's hard to see. Sorry. This one here, what I like to use is this muscle as a landmark muscle. Adductor longus, because it goes about halfway down the thigh. Okay? Now, it's hard to see adductor brevis. It's usually coming underneath it. Pectineus would be above it. Deep to all of these would be the adductor magnus. You can find adductor magnus either from the front or from the back, but it's deep. So if you see a muscle that's really broad, you know, that's adductor magnus. But this adductor longus is a nice, to me, a little landmark.
What is that insert?
Okay, almost all, we call this the medial compartment. Those, and these are the muscles in general that are adductors. That means you pull your leg in or like your thigh in or like that. How often do you do that movement? Very often? No. So they tend to get flattened. You do your thighs, right? And Susan has made a fortune out of that with her thigh master. Okay?
Or the adductor machine.
Yeah. So that's to try and prevent getting flabby thighs, okay? But that's it's useful often to think of things in terms of compartments. So this is the medial compartment, which is adductors in general. And in general, they originate on the pubic bone and insert on the linea aspera of the femur. In general, there's a few exceptions, okay, like the gracilis, and the adductor magnus. The adductor magnus is so big it also originates not just on the pubic bone, but also the ischium. And it also inserts way down in the adductor tubercle of the femur. But in general, pubic bone to linea aspera. Okay. So we have the pectineus, we have the adductor magnus underneath, would be the adductor brevis, adductor magnus, totally deep on either side, but big, covering a big distance. Okay, let's look at the anterior compartment. These are called the what? Quadriceps. And they're really 4 separate muscles that we group them together. And they're involved in the forcing of water. When you take a step forward, flexing at the hip, extending at the knee. Now, there's only one that is involved in flexing at the hip. Anybody know which one covers the hip joint, crosses the joint? It's the rectus femoris. So it originates above the hip joint on the anterior inferior iliac spine. Okay. The vastus lateralis is the biggest one. It originates on the femur, so there's the vastus intermedius and the vastus medialis. Vastus medialis can be sometimes really big. In bodybuilders, it's called a teardrop. But the largest is the vastus lateralis. A real good place to give injections, intramuscular injections.
The lateral.
It's the largest of them. It's the largest of them, especially in infants, because their muscles aren't very big, right? They're wimpy little muscles, okay? So vastus lateralis is a good one. Sometimes they use the blade too, but vastus lateralis is a good one. Deltoid's another good place for small injections, and the gluteus medius. 3 good injection sites for intramuscular injections.
Subcutaneous? Is that?
No, this is not, subcutaneous is a different kind of injection.
That you want to
This is intramuscular injections. So you can have IV into veins, you can have subcutaneous, this is intramuscular.
You know people that like work out a lot, they get like bulge right here. Is that the
That's the vastus medialis. Okay, that's called the teardrop. So these are involved in the vastus muscles. There's the vastus intermedius underneath. So there's 3 vastus: lateralis, intermedius underneath, and medialis. So that's pretty easy. If you move the rectus femoris aside, then you'll find the intermedius. It doesn't look so vastic. Let me show you a picture of the vastus. Why they're called vastus.
Your in-and-out smells good.
That's his bathing suit with his you-know-what underneath, okay?
Oh, gee.
This is why they're called vastus.
What? Oh my God.
These are vastus, big muscles on bodybuilders.
Yeah.
Not on our cadavers, mind
Wait,
you.
that's a basket?
That's why they're called vastus.
Which one?
I don't know. Some people.
That's the medialis, okay? This is the lateralis. This is the rectus. So rectus, you tend to think it's probably be the biggest, but it's not.
Like loaves of bread.
So this is sometimes called the teardrop, okay?
Oh my God.
And the knee is the underneath, okay? That's the knee. Yeah.
Christ.
Wow. You can see why.
That's insane.
Well, it's like people, it's like sport for people.
So where was she pointing to the pet? Okay,
And let me
that's
show
the
you
hip
the
canal.
videos.
That's the longest. Okay.
This shows you also how the trapezius wraps around to the front.
Oh, yeah.
But you don't see that, notice that much in people.
No.
All right, so that's.
Because, I don't know, I guess it's a high when people.
And the serratus anterior on the side.
Oh my God.
We can see that on the male too. It's a bad.
8-pack or 6-pack.
It's still really good.
Let's see, I was going to show you, where is it here?
Come on, Jim.
Sartorius, very obvious.
Yeah.
There's the sartorius.
Oh wait. Oh yeah. Oh my God.
Okay.
I don't get it.
No.
Notice
That's
that.
insane.
But they like learn how to flex
Oh yeah.
the muscles, right?
What they do too is they just before competition, they dehydrate and they consult
Really
and
different
everything.
between them and the strong.
And the sternocleidomastoid, you can see across people's necks.
We had a paper about that.
Okay.
For some reason.
Let's see what else I want to say here. Okay. By the way, this model has a mistake in it. Should be the gracilis. They made it look like a tendon. It's a muscle, and it crosses 2 joints too. Okay, so that's the most medial, totally medial of the adductor muscles. And gracilis means like slender. So this one actually crosses joint 2 because remember, it's part of that
And what is that?
3-7 that inserts of the page sensorinus.
Is that an adduct?
It's an adductor too, but it also causes some flexion. Actually, yeah, it causes some flexion actually too. Okay. I know I've left out some things here, but oh well. Oh, these are sometimes called, I think, Christmas tree, because on both, I can see on both sides, it's like a Christmas tree. Okay. Let's look at this group of muscles. These are called the hamstrings, because butchers used to hang the hamstrings from, if you feel behind your knee, you feel those tendons. Those are your strings there, okay? Okay. Now there's 3 muscles here. In our video, they only show 2 for some reason. There's one that is totally lateral. That's the biceps femoris. Do not get mixed up with the rectus femoris. Biceps has 2 heads. That might help you remember. Okay, the biceps femoris, the semitendinosus, which has a very long tendon, and the semimembranosus, which is kind of hidden. That's when they leave out of the video. The long head of the biceps femoris, the semitendinosus, and the semimembranosus all originate on the ischial tuberosity, which you sit on. Okay? And a pulled hamstring is if you pull those loose from the ischial tuberosity, either in part or pull them. Now the short head of the biceps femoris begins on the linea aspera and some other parts of the femur. All of them cross the knee joint. Okay. Now, these are responsible for the back swing walk. Extension of the hip and flexion of the knee. So quadriceps, flexion of the hip, extension of the knee, these are for the back swing walk. And the biceps femoris is the only one that goes lateral.
Is the long head lateral and
Yeah.
short head medial?
No, it's where they originate. Yeah. So both of them, they insert together. On the lateral condyle of the tibia and the fibula. Okay. The semitendinosus, remember, inserts on that pes anserinus. And the semimembranosus is sort of hidden by it. Okay. So this, another way to remember these in order, starting lateral to medial, is bottom. Going across the bottom, lateral B, T, M. Bottom. Okay. Okay. See what else we want to do. Oh, we might have some there. Okay. Okay, now let's look at the, here. This is called the gastrocnemius, okay? That's in the posterior compartment. See, this would be posterior compartment, anterior compartment, medial compartment. Now we have a posterior compartment, anterior compartment, and a lateral compartment. It's a little different. Gastrocnemius, it has 2 heads. They originate on the femur. So this can also cause flexion at the knee under certain circumstances. Deep to that would be the soleus, which looks like a sole flatfish. It does not begin above the knee. It goes below, okay? But they insert together on the calcaneal tendon, the longest tendon in your body, which inserts into the calcaneus, also known as Achilles tendon, okay? So they cause plantar flexion, like pointing your toes. Toe dancer's muscle. You have a big soleus that makes the gastrocnemius more visible, okay? Let's look at the anterior compartment. This lateral to the tibia, you can feel that right there, is the tibialis anterior. Comes down and inserts on the medial cuneiform and base of the first metacarpal. It causes dorsiflexion, and since it's coming medial, also inversion. Next to it is the extensor digitorum. Extend your toes, and also causes dorsiflexion, and extend toes and dorsiflexion. Okay. For the lateral compartment, I'm just going to cover one of these, is the fibularis, also known as peroneus longus. And notice the lateral malleolus here. Its tendon goes behind that, and then goes underneath the foot to insert the same place as the tibialis anterior. But it's coming from exactly opposite directions, so it goes exactly opposite phase.
It's the fibularis longus.
Fibularis or peroneus longus, okay? Fibularis because it's near the fibula. So they make a stirrup underneath the foot. They're coming from stirrup. But since it comes from the exact opposite direction, it causes plantar flexion and eversion of the foot. Then there's some other ones I'm not going to go into that are there too. Okay, what else do we need to do? We need to do these. But maybe we take a little break first. You're probably full. Are you full? Yeah. Take a couple minutes break and I'll do the upper limb if you want. Okay.